This is Journeys with Ryan Franke. Conversations about culture and the issues affecting First Nations people in BC. Brought to you by Prince Rupert Port Authority, linking a world of opportunity. Online, rupertport.com.
Good evening. Welcome to Journeys. I'm your host, Ryan Franke, and we're on your nation, your station, CFNR. On tonight's episode of Journeys, I have Dr. Nel Wieman. Now, she's the Senior Medical Officer for Mental Health and Wellness for the First Nations Health Authority, and also she is the President for the Indigenous Physicians Association of Canada. Now, she comes on to Journeys, and we talk about COVID-19 and just the situation that we find ourselves in, not only just in Canada, but also around the world. Very interesting discussion. We just talk about what the measures are, the precautions everyone's taking, and again, these are all precautions, right? So we're doing this so that we can slow the spread of COVID-19. Now, she also said if you'd like to find out more information about COVID-19, you can go to the First Nations Health Authority website, fnha.ca. Or she said you can go to the Public Health Agency of Canada. Now, the website is a little bit longer, so just Google that. Google Public Health Agency of Canada, and they have all the latest information there about COVID-19, and all the latest info is all there. So let's get right to it. Here is my conversation with Dr. Nel Wieman, the Senior Medical Officer for the First Nations Health Authority and also the President of the Indigenous Physicians Association of Canada.
Hi, Ryan. Thanks. It's great to be back. So my name is Dr. Nel Wieman, and I work as the Senior Medical Officer, Mental Health and Wellness at the First Nations Health Authority, and as well, I'm currently the President of the Indigenous Physicians Association of Canada.
Well, Dr. Wieman, Nel, oh man, what's going on these days? Are you busy at all?
Just a little busy. But for your listeners, I mean, I think it's important that people know that, for people who work in the health field, that, our jobs do not stop, whether or not we are working on the front lines as clinicians, or whether in my current role working in, public health, population health, that the work is continuing, even though our role may be a bit more behind the scenes. That we continue to try to, create a very good evidence-based response to the COVID-19 situation that we find ourselves in here in BC and in Canada.
Yeah, no doubt. Like, I feel, okay, one of the things I've talked to our news department about this, I did a show just about COVID-19, and one of the things they talked about was social distancing, right? And right. One of the terms I brought up that I feel like I made this term because I haven't seen it anywhere else, but I call it social media distancing. And I feel like it's because I see a lot of stuff on social media that is like rumors, or I hear people posting, I heard, and I'm just like, this stuff just drives so much more panic than it does anything.
Right. Yeah, no, Ryan, I completely agree with you. I think that one of the best tips I could give your listeners is, first of all, acknowledging that we are in a really unusual situation. Before the COVID-19 crisis arose, I had actually just finished reading, for my own personal interest, a book about the Spanish flu of 1918 and pandemic. And of course, the message is, we should stay on alert because the next pandemic is coming. And I read that in the book, and I was like, yeah.
Yeah.
But then it came almost right away, and we're in it right now. And so I think for people, for your listeners, it can be really challenging to manage our own sense of anxiety because we don't really know that much. We're still learning about this virus and sort of, what does it mean for certain populations, and how is it changing our behavior, and how long is this going to go on? How serious is it? And one of the things I think that I could recommend as a tip is, all of us need to, I think, decide for ourselves, what is a healthy limit for us in terms of our exposure to both, the television news channels that run 24 hours a day, and especially social media, because people are posting quite a bit about COVID-19 on their Facebook pages. And the best example I can think of that happened over the weekend is there is a post that's going around that is a picture of a throat, someone's throat, and it says, COVID-19 starts the first 4 or 5 days with a sore throat, but if you gargle with salt water, you'll be able to get rid of it. And that is like complete medical misinformation. So I think, and these are good people that are sharing this information because they just don't know that it's, false information. I think we can all keep, we can all maybe keep a better handle on our anxiety about this if we try to set some pretty clear limits about how much time we're going to spend. I mean, we do use, now that we are in a situation where, the Public Health Agency, the Provincial Health Services Authority, and First Nations Health Authority is now, in asking people to do social distancing. We rely on social media to keep up with our friends and family. And so if we can maybe put the focus on, sharing how our family's doing or some fun activities that we've been involved in, that might be a little bit better than constantly sharing, sort of news about the outbreak itself. The other thing I posted about on my own Facebook was I said that I would be posting both, relevant evidence-based information interspersed with some humorous posts, because there was an article I read, I think it was from an Indigenous news outlet, I think in the United States, talking about how humor is good medicine, and that we've used humor for hundreds of years to help us get through some hard times and shore up our resilience. And so I believe in that. So I'm kind of on my own personal page, I'm making a point of sharing, important need to know medical information, but also some funny things, that have happened, just to try to lift people's spirits, including my own.
Yeah, totally. I mean, and that's the thing, like your medical background, your medical expertise is in psychiatry, right? So you would know a lot about, like, say, just the mental health and what I call groupthink, where people like do all this panic buying and stuff like that. It's like this pack mentality. Like, it's pretty crazy. And one of the things about humor, just before I move on to talk about some more of this, was I agree with you 1,000,000% on the humor. I feel like sometimes all you can do is laugh at some points in your life. And one of the things I did post, I posted about the toilet paper. I was like, I called it my res tip. I said, res tip of the day. I said, if you separate your 2-ply, you double your amount. I'm like, there you go. But anyways, you are right about just, people sharing information, misinformation on Facebook or social media. I think it sometimes it borders on recklessness. I think some people, and they're good people. I know some good people, intelligent people that are posting stuff that is just, it boggles my mind. I'm like, it's crazy. Right.
And I think, the point you make about, just to finish up that thought is, I think humor is a good thing. It's a coping mechanism, and it really, I think, is a strength amongst Indigenous people. We are really funny, and a lot of the stereotype is that we're these stoic First Nations people, but really the funniest people I know who are Indigenous. So I'd encourage people to still try to find the humor in things.
Nice.
That helps keep a balanced perspective. And then what you were saying about, the herd mentality, I mean, I shouldn't say that it's been shocking to me, because it really isn't.
Yeah.
But, it is a bit of a vicious cycle where you have the people who are, hoarding and stockpiling certain products, like toilet paper, the hand sanitizers, canned goods. Like, I went to a couple of different grocery stores on the weekend just looking for 2 cans of chickpeas, because I actually meant to make a stew on Sunday night. and I could hardly find them.
Wow, yeah.
I think what happens then is it makes each of us feel like, oh, well, if it's all gone, then when I see some, then I'm going to get it all because there's not going to be any, and it sort of feeds itself, right?
Yes.
And that's a really challenging mindset to try to not get into, I think, and sort of try to. I think, one thing that happens is we have, first of all, for Indigenous folks and First Nations people, we know, many of us have the experience of trauma in our lives.
Yeah.
Both, from a long time ago, historical trauma, intergenerational trauma, and even traumatic things that have happened to us in our lives. And this is, in some ways, another trauma that we are all going through, not just in British Columbia or in our First Nations communities, but Canada as a country and really the world, trying to deal with this pandemic. So I think we have to try to, if we can, having a condition of chronic post-traumatic stress, I think makes people, unusually sensitive to anxiety and alarm. People get triggered easily, and that can set off a cascade of emotions. And so doing things, sort of getting back to basics in terms of, your sort of mental health care. It's like, making sure you are getting enough sleep if you can, trying to get out and get, even though we're asking people to social distance, we are also asking people to get out and get some fresh air. Get some exercise in the outdoors, like places where, closed spaces where you might live or where you might congregate with someone. We are now asking people to get outdoors. And being outdoors with some personal space will allow you to sleep better at night. And of course, now we're having a bit of sun here in Vancouver, so that vitamin D can be really helpful in terms of people's health as well. And then just doing things that you need to look after yourself. If it's sort of practicing some meditation or listening to like a YouTube video of a mindfulness exercise, or just, being by yourself and doing something that you enjoy, like beading or knitting or sewing, whatever that might be, that things that make you feel good. But the other thing I think that combats both, helps our mental health and combats that herd mentality, is to think of creative ways that, we sort of stop thinking about ourselves and focus inward, but we think about, sort of something outside of ourselves. Mm-hmm. And, as an example, I was saying to my partner on the weekend, I live in an apartment building, and there's 6 other units on my floor, or there's 6 units altogether. And so I thought, well, I'll write a little note with my phone number and say, this will be our little group, and if any one of us gets sick, then you can text me or text the group, and someone will arrange for someone to go get groceries for you or go buy, milk or orange juice for you. We don't have to meet because we're supposed to be social distancing, but we can form this little text message group and just keep in touch with each other. And that's one way. I mean, I'm not able to take care of the whole building, but just the 6 units is manageable, and that maybe people can do that, in their communities, wherever they may be, is form like a small network and be able to check in, on your phones with each other to make sure that you're okay as we go through the next days, weeks, and months, quite possibly. Yeah. But it's that act of like looking outward, looking after the good of other people. I think that brings us out of ourselves, right, and gets you out of that spiral anxiety thinking that people perhaps with chronic post-traumatic stress get into. It's very difficult to get out of that spiral, but one way is by trying to turn your focus onto helping other people. And, that's the way that it goes. You see the people nowadays, who are behaving badly, like that couple that bought all the hand sanitizer in the Greater Vancouver region.
Yeah, that burned me, man. I was like, who are these people?
So these are people who think of nobody but themselves.
Yeah.
And then there's the people who rise to the surface in the face of adversity and think about their fellow community members or their family members and do something quite simple, but that shows that they're caring for each other, right?
Yeah.
So those are the kinds of people I believe that we are, and we will rise to the surface on this. We will come across as, resilient, strong people who care about each other and will be together through this, and we will get through this.
Oh man, I couldn't have said it any better. That's so true. I feel like Indigenous people do that too. Like we really take care of our extended families, and like we're always checking in on our parents, our grandparents, our elders, making sure that they're taken care of. Like I've been reaching out to my parents, my mother, and making sure she's okay. And because she doesn't, she's in her 70s, and rightfully so. She doesn't want to be going out shopping or anything. So I'm like making sure that she's going to be okay, right? I think that's a good thing. And I think that's another thing too, just to be compassionate, right? And to be patient too, be compassionate and patient with each other, because, we're all kind of learning how to deal with all these changes. And again, these changes I've been telling this to people, is these are precautionary measures so that we can slow the spread. And I think that people should look at that as a positive, not a negative.
Yes, absolutely. I mean, there are very real reasons why the public health authorities are suggesting that we undertake these measures, such as social distancing. So by social distancing, we mean literally trying to maintain as best you can a personal space around yourself of at least 1 to 2 meters. So that would be about 2 arm lengths of an adult person, approximately. And that may or may not be possible all the time, especially if you live, say in a housing situation where you might have a couple of generations of a family living together. But definitely, in that case, try to give each other as much space as is possible, but also adhere to all the advice that has already come out about frequent hand washing, use of hand sanitizers. Try not to touch your face, but most especially your eyes, ears, nose, and mouth. I'm really bad at the face touching. I have allergies, so my nose is constantly itchy, and I have to really stay away from it. But so if you have to live in close quarters, it's really important that you do try as best you can to just make sure that you're constantly washing your hands, using hand sanitizer if you're able to get it. And trying to maintain that personal space. But really, we're asking people to stay not indoors. You can go outside and have a walk in the bush or whatever on a path by yourself or with a few family members. But we're asking people to try as best as you can to not be out and about in public. If you go to a store, for example, try to go at the off hours, either early in the morning or later in the evening. Just try to avoid strangers mostly, and people who aren't as close to you as much as possible, because it really is all about what they call that phrase, flattening the curve, which you've seen, which you've heard many times now. probably on the news.
Yeah, so flattening the curve for people, and this is my understanding, is that if you're to put a graph there of the number of cases of infected people over time, that the initial spike is because everyone is spreading the disease, so you have a huge spike in the numbers of people infected, but we're trying to flatten that curve so that curve doesn't go up so quickly. We have more of a steady, slower increase of infected people over time.
Correct.
Okay.
One of the things that it's important to remember is on that graph that people see, there is a line that runs kind of, from left to right. That is the sort of capacity of the healthcare system.
Oh, okay.
So we have a limited healthcare system, particularly with regards to people who become ill with COVID-19 and require intensive support, like being in the intensive care unit or needing to be on a ventilator.
Yes, yeah.
To assist their breathing. So we only have, I'm not sure of the exact number, but it's somewhere around 3,000 or 3,500 ventilators in this country.
Okay. So those are like gold then, right?
Right. So if we all hang out with each other and cough into each other's faces without covering our hands and spread this all around where many of us get ill within the next 2 or 4 weeks, we will all overwhelm the healthcare system. And that's that first peak you see on that graph where the peak goes way up and then it comes way down. So we exceed the capacity of the healthcare system. If we stick to, some of the containment strategies that the government has, implemented, like trying to close the borders, recommend against non-essential international travel, if we practice social distancing, that means we still may get cases over time, but it's like that peak has been stretched out and it comes lower and actually beneath the healthcare system capacity line of that graph, so that, I might get sick in April, you might get sick in June. But it's spread out over such a period of time that there will always be a bed available for you or I in this example if we should need it.
Yeah, no, I think it's really shining a light on our healthcare systems in every country around the world. Like, what do you think about our response to this? Do you think it's been enough and quick enough? And do you think our healthcare system, I'm assuming you might think it's underfunded, but I want to know what your feeling is about our healthcare system and how we should maybe go forward after we get through all this.
Well, I think, I have this COVID pandemic, it's named COVID-19 because it actually started in China in late 2019.
Yeah, in December.
So this has been going on for 3 or 4 months already, and here at least through my work, I've been following the COVID response, Canada's COVID response for, I guess it has been a couple of months, even though the time really has flown by because it's been so busy. But I think in general, we can be confident that our public health system, both federally and provincially, has been pretty robust. It's been pretty good.
Okay.
And I don't want to point fingers necessarily south of the border as a comparison, but I will, to a certain extent, that I think we have had, pretty consistent messaging. Yeah. And we have done our best, I think, to try to stay on top of things so that we are beginning to see, hopefully, we'll know in the next week or so whether we have actually, in Canada and in British Columbia, whether we are on that trajectory that corresponds with a flattening of the curve.
Yeah, for sure.
But we have not had the same difficulties with accessing testing that the United States has. And we have, I think our messaging has been quite strong on, trying to, the sort of personal hygiene, the social distancing. It's been kind of, it's been out there, and people are starting to know what they personally need to do.
Yeah.
I think we could probably do a little bit better here in British Columbia, for example, and here where I work, is really start to put out more specific messaging for different populations. So for people who live in rural, remote communities, we need to put out more specific messaging about how do you do social distancing when you live in a crowded house, or if you have to be in quarantine, where would you go to do that if there's not too many options available? Or pregnant women. I just saw a new message come out from the Society of Obstetricians and Gynecologists today around pregnant women and how, we need to be careful. We have to treat pregnant women very carefully in trying to limit the potential for them to become infected with COVID-19. So that's another one. And I think the one that I feel particularly passionate about is trying to help people who do live with chronic post-traumatic stress, just get through this, because it's so anxiety-provoking, I think, for people. And if we can, I think one of the ways we can be helpful is even just to acknowledge that many of us feel triggered by this pandemic because it's another kind of trauma, and yet we don't really understand it, and we don't know exactly when this is all going to end, right? And things are going to kind of return to a new normal or a normal. But the other thing I just want to reassure your listeners is, when SARS hit, years ago, public health officials learned a lot from that. And I think that experience has informed our good response to COVID-19 now. And so the one hopeful thing as well is that this, we are learning as we go right now. We are learning more about how to respond, about how to communicate effectively and quickly with each other. And this will also be, good for the healthcare system moving forward. So that if anything happens, if there's a different virus that emerges, 4 or 5 years from now, that all the lessons learned from these experiences sort of pay dividends, if the next thing, when or if the next thing happens, right?
Yeah,
because,
for sure. And I mean, it probably will happen though, right? I mean, it's kind of a question of when, not if. Is that kind of a fair statement?
Yeah, I mean, I think, if you look back at history, as far back as we've recorded, we have had pandemics in the past. Yeah. And it's sort of like, like I said at the beginning when we started talking, that, we all were talking like even 6 months ago going, there'll be another pandemic. It's just a matter of when. But now we're actually in it, right? Yeah. And so it's kind of it seems something that seems a bit surreal has all of a sudden become very real. And so we need to, knowing that things aren't probably going to change dramatically anytime soon, that we're going to be living sort of under these conditions at least for the next several weeks or months, that, we need to, because we can't change our external circumstances, we can look at how we can change our coping strategies internally to help us get through this. The other thing I just wanted to kind of in some ways end with, I think it's important to acknowledge, the healthcare workers who are working on the front lines, the nurses in the nursing stations, all the other healthcare professionals that you don't typically think of as, working on this pandemic. So the pharmacists that are dispensing medications, the ambulance drivers, paramedics, even the public health officials without patting myself on the back, but who are putting in long hours to make sure these resources are available. People are working very hard, and that's what we're trained to do. And we look to be able to use our skills to the best of our ability to ensure that we get through this with as minimal loss as possible. I mean, that's our hope.
Yeah, for sure. I mean, okay, so one of the things you mentioned was testing. So I'm wondering about testing, what's happening, especially for up in the north and remote communities. And then after that, maybe we could talk a little bit about the First Nation communities that are remote, like how vulnerable they are to the system and what precautions they should take if they're different from what you're saying to everyone else.
Okay, so testing, in general, I would say that, if you're presenting with just general cold symptoms, that a test is not required. So I should probably make the difference that the three symptoms that one needs to be concerned about is if you have a fever, if you have a dry cough, not a productive cough, and by productive I mean like you're coughing up gunk, sputum, and so fever, dry cough, and difficulty breathing.
Okay.
So you feel short of breath. So there are, cold and flu season is still going on.
Yeah.
So there's many more people with cold symptoms than with flu symptoms, and flu symptoms than symptoms of COVID-19. So the advice in general that's being given right now is that if you have cold symptoms, that you try not to bog down the health system, even if you live in a small community, and stay at home, keep yourself isolated from other people, and your symptoms, will most likely resolve.
Yeah.
If you, for example, have the symptoms, or you have a history of travel, or international travel, or you may have been exposed to someone who has COVID-19, then, you would warrant a test. But as far as my understanding right now is that testing is available to everyone.
Okay.
It's probably important for your listeners to know that there is also, a special group that is meeting that is specifically dealing with the special challenges of rural and remote communities.
Okay.
So there is attention being paid in those areas as well. But by and large, what we're trying to ask people to do, and people can again think of that flattening the curve chart, is we're asking people not to overwhelm the healthcare system just because they might have like a productive cough, nasal congestion, a headache, that type of thing, and they feel otherwise well except for a common cold. That's just going to slow things down for people who may actually need those resources.
For sure.
And monitor, if you're not able to, if you don't own a thermometer at home. If you really, people really can kind of tell when you've got a fever. It's a definite change from how people feel usually. In that case, they may want to go to their local, say nursing station and have their temperature checked. But in general, unless you really feel extremely unwell that you need medical attention, the advice is for people to remain at home and do what you would do if you had a cold or a flu in general, right? You'd probably drink lots of fluids, you'd get lots of rest.
Yeah.
Those types of things. And, colds and flus do tend to resolve within a few, or at least start to improve within a few days.
Yeah, for sure. And I think that's one thing that's important. It's just to monitor yourself and don't overwhelm our system just with, like you said, if there's some things you don't, like a headache and all these other things. Like, I think there's a number too, like an 811 number people can call to get connected with professionals as well. But again, that's only if you actually are sick and have symptoms. Don't just call there for questions, right?
Yeah.
Okay. Now...
There's a lot of information that we won't necessarily have time to go through in the talk today, but if people want to go to the FNHA website, there is actually a whole page with a number of links. It's called Information on the Novel Coronavirus COVID-19, and there's all kinds of links already on that page. The other page that is very helpful if people have access to the internet is to go to the Public Health Agency of Canada.
Okay.
And there's very helpful information in a variety of categories that, is geared to the person who, you don't have to be a medical doctor in order to understand what they're trying to say on that website. So,
that's
but
good.
for now, we are kind of in a situation where we're asking people as much as possible to limit their getting out and about, meaning, not if you're able to work from home, and just do general things to maintain your wellness, right?
Yeah.
Keep your spirits up. Try to eat healthy. Try to get enough rest. And all those things that we talked about earlier.
For sure. I think one thing is if everyone starts beading and sewing, I mean, we're going to have a bunch of new regalia after all this.
I know. It's very interesting that people, one of the things that I had heard on Facebook is that, this is, for a lot of people, so many things are being canceled.
Yeah. That
this is really a time for people to kind of have a bit of a pause in their busy lives and reflect back on, the things that make them happy, like being able to read a book or, who's got the time for that? But now we kind of, some of us actually have that kind of time. So I think, I think what I'm trying to say too is, getting through a stressful time like this, it helps to take a different, the optimistic perspective on things.
Yeah.
That, this is, there's incredible stories coming out of community and people helping each other. And, people we talked about who are rising to the challenge. And it just makes you think about the things to be appreciative of.
Yeah, for sure. I totally agree. I mean, and that's the key though, right? Because it's like a double-edged sword. You can go down be optimistic, and then there's people that are pessimistic, and it's like you just got to flip that switch and be positive about it and look at these are precautionary measures because we learned from SARS, like you said. It was like we learned about all that, so that's why we're implementing this stuff a lot quicker and sooner. We have teams that are meeting. You're meeting. Yeah. I mean, you have doctors that you guys are talking, working around the clock about what to do and precautions and everything like that, right?
Yeah. So I think this is this is a very unusual situation that many of us in our lifetimes haven't necessarily lived through. But I think as long as the one thing I take heart into, like you mentioned, that as First Nations people or Indigenous people, we seem to have that resilience. We have that sense of humor. Many of us have a sense of connection to one another. And, we want to look after our elders and our young people. And so we have all these strengths that in some ways come to us naturally or intuitively. And so I think we actually, because we have lived through so much adversity in our history and yet we're still here.
Yeah.
In some ways, we are the best equipped to get through this together.
So true.
Right?
So true. I mean, so true.
And that's the gratitude part that I was trying to get at, is that, even if we can get a little freaked out at times or feel panicked, I mean, it always helps to reflect back on things that we can be grateful for, even simple things. Mm-hmm. And one of the things I used to say to my patients when I worked clinically in Toronto, the people who had chronic post-traumatic stress, was, one of the things that you can always say to yourself is, despite everything that's happened and everything that, you've gone through, you're still here.
Yeah.
And we're still here. So, and we still are going to be here, and we are going to get through this. we might have to maintain that social distance right now, but there are, technology can help us maintain those connections. And, I think we are really going, adversity is going to sort of help us come through this as communities and as nations of people. And I think that, we are going to almost in some ways be an example for other communities across the country of how people respond in the face of this kind of challenge.
And sometimes you just need to hear it, right? So
yeah.
Thank you for saying that, and thank you for taking the time to speak with me. I appreciate I've said it before. I appreciate every minute that you have for me. So thank you for taking the time to speak with me. Is there anything else that you need to say or want to say?
No, thanks, Ryan. It's always, I'm glad that we were able to have this conversation. And I just would say to your listeners, be well and look out for each other.
And there you have it. That was my conversation with Dr. Nel Wieman. She is the Senior Medical Officer for Mental Health and Wellness with the First Nations Health Authority. She's also the President of the Indigenous Physicians Association of Canada. Now, again, follow all the information that they're giving to you. Again, just be careful about washing your hands lots every day, lots of times throughout the day, especially if you're going to be going out and about. Don't touch your eyes, nose, or mouth unless you have washed your hands because, again, you want to stop the spread of COVID-19. And if you need more information, she said, go check out the website at First Nations Health Authority, fnha.ca, or if you Google Public Health Agency of Canada, they have a great website with lots of information. Also, I did talk with Christian Apostolevsky from our news department, and we talked about the World Health Organization has a good website, who.int. There's also the BC Centre for Disease Control, and you can go to their website, bccdc.ca. And so there's lots of information out there, but again, I think just have some common sense, right? Just don't go out into public places if you don't have to. Wash your hands lots. Be aware of that. If you do have a cough, to cover your cough into the corner of your elbow. Also, you wash your hands lots and use sanitizer if you can. Again, these are all basic stuff from the flu, just from stopping the spread of the regular flu, right? So now we're just trying to slow the spread of COVID-19. And you heard Dr. Weiman say that slowing of the spread is what enables our capacity of our healthcare system not to be overwhelmed. And that's what we don't want, right? And just even her talking about the ventilators and stuff that we have in Canada, I mean, we really need to make sure we don't put too much stress on our healthcare system. And again, I think, her talking about Indigenous people and the trauma that we've been through and through our multiple generations, and we're still here. I just, sometimes you need to hear that. We're going to make it. We're making it through all this stuff. And it's, we'll learn more this time. And then for the next time it happens, we'll be more and more prepared every time, right? So, again, just exercise some common sense and everything will be fine. Okay. I hope you enjoyed that conversation. Let me know what you thought of today's episode. Hit me up on Facebook, CFNR Network, and leave your comments. Also, go to our website, cfnrfm.ca, and go to the App Store and download the CFNR app. That's it for me today. Until next time, let's see where the journey takes us.
This has been Journeys with Ryan Franke. Join us next time for more conversations about culture and the issues affecting First Nations people in BC. Brought to you by Prince Rupert Port Authority, linking a world of opportunity. Online, rupertport.com.